Did you know there's a way to find out if your child could develop cancer in their lifetime before they're born?
ABC6's Terry Sullivan discusses the new advancements in genetic testing with a doctor who tells expectant parents the health of their child before they reach the womb.
This baby is growing every second of every single day, and his parents have peace of mind knowing when it's time, the odds of him being born healthy are pretty good.
We feel wonderful. We're ready.
They know this because after in vitro fertilization, when the little guy was just an embryo, they had him genetically tested, mainly to make sure he'd survive the pregnancy and that all 46 chromosomes were normal and in place. It's called genetic testing, where embryos can be tested for potentially deadly diseases.
The biggies are breast cancer, BRCA1 and 2. If a woman's mother had breast cancer, grandmother had breast cancer, sister had breast cancer, they better screen for breast cancer if it's a girl.
They can test for cancers common in men, too.
Colon cancer, prostate cancer, certain types of pancreatic cancer.
Dr. Jeffrey Steinberg says they have a menu of nearly 3,000 diseases an embryo can be tested for, which is why parents are screened first to figure out what diseases their child could be at risk for the most.
Then we help them narrow it down, and we narrow down to where we get to the few things that may be vital for them to know.
Genetic testing cannot determine eye color, hair color, height, or if a child will grow up to be an athlete, which, believe it or not, is a request he hears from celebrities all the time.
They want a good tennis player. Can you tell them that their baby will be a good tennis player? We don't, and we tell them it's not available. But it's a request. It's a very common request.
But for parents who are truly concerned about the health and well-being of their baby, genetic diagnosis can be a blessing and a curse.
I think if a patient is experiencing some problem, like carrying a BRCA gene, and they know what it's like to constantly worry about breast cancer or ovarian cancer, and they know how their life has been altered by all of the evaluation and doctor's visits and worry, that it's their decision to make whether or not they want to eliminate this gene from their family so that their children and their children's children don't have to worry and make decisions that they've had to make.
As for Heather Craig, she just feels blessed to have him in her life, no matter what flaws he may or may not have.
I believe that God gives you what you're supposed to have and what you're supposed to be able to handle.
Terry Sullivan, ABC6 News.